Amazon. All right. We're live.
Come on in, folks. Come on in. Join the party.
Party?
Today we are talking about knee pain and knee problems and knee fitness. And we have a plethora of products that will help with this. And some of them you probably have never seen before because Brad and I invented it. This is actually not Brad. This is Mike. Oh.
Hi.
So what we're going to start off with is the Knee Glide and the Fit Glide. Now the Knee Glide is probably a little more specific to someone who's had knee surgery.
Yeah.
Because you're going to use it on just one side.
Yeah.
And it's just like it sounds. It helps the knee glide. And it's very lightweight. That's the point we want to make. You can actually lift it with one finger. And so you can transport it around the house. Now, if you've had a knee replacement, what you may realize is that quite often people will recommend using a washcloth on the floor.
And do floor scrubs.
And do floor scrubs, right, as Mike says. And that works fine until you have carpet.
Yeah. It's not as smooth, especially with shoes on. I mean, this is pretty rough. If my knee hurt, I would not be doing this.
Right. And after knee surgery, you're trying to gain more motion back and you're trying to gain strength back. Very difficult to do on a carpeted floor.
Yeah.
Sometimes we recommend taking the oven. I'm trying to think.
Cookie sheet?
Cookie sheet. That's what I was trying to think of. A cookie sheet, and you can put a cloth on there, and that kind of works too. But where this really helps out, and I'm going to actually get on the floor, Mike.
Go ahead.
When you start in bed, there's no other way to do this, and this works out really well for that. So I'm going to get down. This shows you how much I think of you guys, that I'm actually willing to get down on the floor for you. So when you lie in bed, to start off with, right after surgery, and obviously you can do this without a shoe on, but you can start, I should probably put it on this side.
You should probably put it on the front side, yeah.
Yeah, there we go. And you can just start getting that knee moving without any help. Now you could even take the other leg and help it if you don't have any assistance. Now, if you do have a therapist or a family member, they can help you too. But what I have found is people after a knee replacement or knee surgery, they like to be in control. They don't like people pushing on their knee. They do better when they actually do it themselves. Mike, do you mind putting the Fit Glide in place too?
Sure.
So the Fit Glide is very similar, except that it's double. So that now this one can be used for, as it implies, fitness, and it can also be used after surgery. Really good after. I can't see what we're doing. All right. So now you can go ahead and actually start working the legs in bed. It's very frictionless.
Yes, it glides easily. This one's more, you can use it after knee replacement, hip replacement if you follow your precautions, but you get both legs instead of just one.
Yeah, you keep the other leg fit while you're trying to rehab the one. Plus, if you just are very bedridden at this point, very wore down, this will help. You can help get in shape in bed without having to get out. You can actually get some aerobic capacity.
Yeah.
So, and again, you don't have to wear shoes. You can put a towel on it, or you can try to just put your bare heel on it. But it'll work well for what ails you.
So these can also be used in a seated position, both of them. They come with carrying handles that double as a stand.
I'll take this one.
We'll lift this up a little bit so our heads aren't chopped off.
All right, so now I have the stand up in the front. And this makes it at a good angle for most people. It makes the ankles comfortable.
Yeah.
Sometimes, like my wife was using this, and she did not like it down like this because it puts a stress on the front ankle. See how my feet are starting to come up.
So you can use them forward or backwards or flat. Obviously, the way I'm doing it is going to work your hamstring a bit more. If you want some resistance added to it, say it's a while after your knee surgery, whether it's ACL, PCL, meniscus, or total knee replacement or partial, eventually you can start strengthening it. You can put a cuff weight on your ankle as well, and then you get some resistance.
That's quite a list, Mike. I'm impressed. So, yeah, he's working hamstring more now because the stand up is up in the back. I'm working quadricep more because the stand is up in the front. And this one is also very lightweight.
They're both lightweight.
Yeah.
That one is about 5 pounds. That is the Fit Glide. The Knee Glide is like 3 pounds.
3 pounds,
Yes,
I believe.
3 pounds. So the dimensions of this one are 32 inches long. It's 5 inches wide, and the height is 5.5 inches. So that's the pretty small and compact, easy to bring with you.
And I'm going to make a point about this. They aren't completely silent. There's a little swish, swish noise. If you're thinking about using this in the office, which you can, use it under your desk. What I like about this, you will make a little noise though. And you can actually put a little, I think silicone works to help smooth it out. It makes hardly any noise at all then. But what's nice about it under a desk, it's not like a pedal device that actually hits the desk. This actually can slide under the desk and see the knees stay level so they don't bump up and hit the desk.
Yeah, and this one is $90. That one is $140. Obviously, you get twice, both legs at the same time. We used to give the knee glides out to a lot of our patients after a total knee replacement. And a lot of people liked them because they said they would look at it and remember to do their exercise.
Right, exactly.
Where if you got to get the floor scrubber machine out or the boards or the cloth, they were less prone to do it.
Yeah, I found people, I don't know what it was. It just seemed like because it was easy to use, they got more range of motion, more knee movement after surgery using these. I had one patient in particular, I don't think you worked with her, Mike. We had to get her to 90 degrees, a right angle or better in order for her to have surgery. And we only got to like 100 degrees. We just couldn't get any further. She came back and then we tried the knee glide on her and we actually got to like, it was beyond the 90. So I'm saying it wrong though, 100 degrees. I want to.
100 is beyond 90.
100 is better.
Yeah.
No, she was only like 80 degrees. So
she was lacking some knee.
She was lacking 10 degrees as opposed, and at the end, she actually gained the 10 degrees. So these are well constructed.
Yeah, they're meant to be used seated or laying down. You do not stand on them.
No, do not stand on these. And we have a sticker on there
that says do not stand.
No standing. And these are aluminum here, so they're hefty. They're good solid device. The rest of it is a type of plastic, but and we got some numbers on here too that you can work to figure out how far your knee is bending.
Yeah.
You won't be able to see those on camera.
Yeah, that is the Fit Glide. The knee glide doesn't have the numbers. I should say too, I'm 11.5 shoe, and my shoe fits in here. What are you, 12?
I'm at 12.
Bob's a size 12, so our shoes fit in there. You don't have to use
Easily,
shoes.
I could say a 14. You could get it up to maybe even a 16.
You can go without shoes just fine. It works as well, so you don't have to use shoes, but you can. It's just an option.
Shaquille O'Neal, you might have a little trouble.
Yeah.
You might have to go over the edge.
If you're 7-footer, you might be struggling there.
So,
but very lightweight, portable, easy to use.
By the way, if you have any questions about knee pain, we will accept those, and we'll tell you if we have any product here today that'll help, or if we have any other advice, we can give it to you when I think of it.
Yeah.
So
these are actually created by you and Brad.
Right.
Brad was the mastermind behind it.
Brad was the mastermind, and his brother actually played a little bit of a role. They both have engineering minds. I did chime in once in a while.
Yeah.
I came up with the handle idea, and could use it as a stand.
It's got some nice little grips on the bottom as well, so it won't slide around on you. And these were prototyped for years before you guys actually even made them.
Right. It took a long time.
We used them in clinics for years before they were on the market. I remember that.
But we actually, as Mike said, we sent this. At the end, I sent it home with everybody. I mean,
Yeah.
Everybody who had a knee replacement.
Every facility we usually kept a couple at, and then we'd hand them out as needed and just kept them tallied up. But
I just got to tell you a story real quickly. There was a therapist I had working for me, and she first saw it. She's like totally negative about it. I'm not going to use that. What is that? She didn't say it to me. She said it to some of our staff. And then in the end, she was asking for a couple more. So I knew we had broken through the market with her. So
yeah, they're very useful. I mean, like someone that's my age and doesn't have knee pain probably isn't going to use these things. But if you have knee problems, knee surgeries, rehabilitating, they're very practical for that. Question.
Camera person, Danny has a question.
This is from Donna. Will this work for IT band knee pain and stiffness from arthritis?
So this is from Donna. The question is, will this work for IT band pain or arthritis? Will not work for IT band. It actually could irritate IT band because IT band goes along the outside of the knee and irritates from constant use, like biking or running.
Yeah.
And you actually want to stretch out that IT band.
Danny, I'm gonna bring that one up.
Sorry.
The massage guns would possibly help with IT
massage
band
guns. Yes.
That we're going to be talking about. Possibly the Thermatex we're going to be talking about too would help. But that would be about it for IT band.
Yeah, you need to stretch, but the stretch strap is not needed for that.
Yeah.
This would help arthritis, though. What you may not know about arthritis is that arthritic joints love movement. And that kind of goes against what you think, because you think, at least I thought when I was younger, well, if it's an arthritic joint, you let it rest. But anytime you move the joint, it actually helps promote the synovial fluid, which is like a kind of lubrication oil in the knee. So the more you move the knee, especially if it's not any weight bearing like this is. This is very little weight bearing.
Yeah, there's not much resistance.
Now, if you're running, that's a different story because you're putting pressure on the joint too. But
yeah.
So you actually want to get more movement with an arthritic knee. This is a very good thing to put under your desk if you have arthritic knees.
Or on the couch as you're watching TV, any way that's
good point.
You can just mindlessly kind of do it. It's going to help increase your range of motion in your knee.
And a little bit of your strength.
Yeah, improve your joints. Synovial fluid, increase blood flow to the area. So it's going to have a lot of different benefits that way.
Yeah, I went to this clinic and there was one of my fellow therapists reviewed a study about arthritic knees in rabbits. And
they have knees?
Yeah, they have knees. And what they did is they took an actual one set of rabbits and they immobilized their knees. And the other set of rabbit, they actually moved their knees. And they both had arthritis.
Yeah.
And they found out the arthritic knees did way better. And we see this in patients where after they've been immobile for a while, the knee gets really stiff and painful, and the ones that keep it moving do a lot better.
I think a rabbit's as big as this.
Very good.
I don't know if it'd work. Yeah, we have another question.
Take the rabbit and go like this.
This is from Jeff, and he's wondering if these machines versus smooth floor and woolen socks, if there's any benefit.
Yeah, Jeff is asking if a smooth floor and a woolen sock would be, this is any benefit over that. You must have missed that part where you were talking about that. You can absolutely do that on a smooth floor. That's how patients did it for years. We just haven't put a cloth down. The benefit to this is, one, you can do it in bed. You can actually lay this unit in bed, and you can actually work both legs, or you can work a single leg.
Yeah, and then this one you can also go flat or incline or a decline, where with the sock and the floor you obviously can't.
Right. So if you're have it inclined here like this, you're actually working the quadricep more, and if you have it declined the other way around, so it's in the back, you're working the hamstring more.
So that'd be flat, incline, switch it around, it'd be decline. So you can have a variation with it.
We found that, the other thing is, like if you're going to work it, let's say under your desk while you're working, I don't see people taking their feet with a sock and moving it back and forth.
No.
There is less friction than a sock on a smooth floor. It glides really easy. If you want to add a little resistance, you can put up the stand, and like Mike said, you can add some cuff weights.
Yeah, we put a cuff weight around your ankle, get a little variation. I mean, that one, if I go like hamstring variation and I have cuff weights on, it gets tiring.
Yeah, that one I'm surprised at. Hamstring
I did it for
really,
like 10 minutes.
well, especially if your knee is rehabilitating from something. It's
I
going
mean, I don't have any knee problems and I'm only 33. So, but I'm saying like, if I did that backwards with like 10-pound cuff weights, my hamstrings are going to start burning after a while.
Listen to him brag. I'm only 33. And I'm only 61.
Only like almost half your age.
Yeah. All right. Do we want to go to another product, Mike?
Sure. Any more questions on the knee glide
Any
or
questions
the
on the knee
fit
glide or fit glide?
Fit glide is a double, knee glide is the single.
Yep. Again, very lightweight. This is where it's really nice. We have a question. This is where it's really nice because if you are elderly, you can move this anywhere in the house without a problem. I'd say most people can lift 5 pounds or 3 pounds.
We've had patients walk in with their walkers after a knee replacement carrying this just fine.
Yeah, exactly.
So, another question. Yes, Danny?
Question?
This is from Deb. She's wondering about using a ball under your foot compared to the fit glide and knee glide.
So Deb is wondering about using a ball under your foot instead of the knee glide or fit glide.
I'll get a ball to show you.
Mike's going to grab a ball to show you the difference. I like how you think, though, Deb. There are some instances where that actually we like to use the ball a lot of times for the arm. We put a ball on the table and slide forward and helps gain shoulder range of motion. The knee might be a little more tough unless you use a big physio ball and put both legs up there, and then that would be uncomfortable. But Mike's going to go ahead and show you right now.
This is just a kickball. I mean, you got a lot more proprioceptive work because it's going to go all over the place. And if your knee hurts, it's not going to work well. I mean, if you're you can coordinate it and go, but it's going to roll away on you. It's a little more obscure. A small ball, this is like a cross-sized ball. It's going to be, you can roll, but again, you're going to have this weird proprioceptive work in there, and it's not going to be as smooth.
To me, it depends what you want to use it for. If you're after a knee replacement, you have a very tender knee, and you want to be going back and forth like that. You want stability. I would stick with either a washcloth on the floor or knee glide or fit glide, something of that order.
The only time I ever use a ball like this is for my plantar fascia rolling.
Right.
That was what you would use this for. But for your knee, no, you wouldn't use a ball.
Works out well for that.
Plantar fascia is sore. Ooh. Anyway.
Yeah, sometimes you're surprised. You think things are fine, and then you try the ball, and things are not fine. What are we doing next, Mike?
Whatever you want.
We got more questions.
Oh, another question.
Another question. Sorry, we're back to the knee glide and fit glide yet.
Don is wondering how many slides do you recommend per session?
So Donna is wondering how many slides we recommend per session. That's a good question.
I'd go depending upon what you're doing. If you're knee replacement, you're sore, do 5 or 6 holds maybe, or 10. If you're doing it for exercise or movement, you want to go for time.
Right.
So it depends. If you're really sore, fresh out of surgery, like a few days after, and you have to work on it, just do it like every hour or two, do like 5 or 10 of them, and just work on holding. Where if you're just exercising for the sake of exercising, go for a time limit that you can handle.
Yeah, you can start with, if you're, again, exercising, you can go for like 10 minutes. If, the first day you may only want to go 5. You want to see how you tolerate these things before you
go
crazy.
Most like total knees, we'll have them bring them back. It's like, say they can only go about here, which is less than 90. And then we might just have them use their other foot and just push a little more.
Yeah,
hold it for like 10 to 20 seconds and then relax. We might have them do that 5 to 10 times in a therapy session, but we tell them to do that numerous times a day. Where Bob's using a Fit Glide, so he's probably going to be more exercising. Do 5 minutes, 10 minutes, whatever you can handle, and then just build up your endurance and time from there.
I mean, yeah, at some point you can go up to like 20 minutes, 30 minutes, even while you're watching a TV show.
Yeah.
It
depends upon how sore your knee is and how in shape you are.
What we recommend is after knee replacement, I always have the speech with everybody, and I always tell everybody to talk with everybody. And I always tell them the most important thing is to regain motion. You will regain strength, but we want to gain motion as much as we can right after knee replacement.
Yeah.
So I have them at least 3 times a day dedicate themselves to trying to gain motion. That's at least 3 times a day. They can do, like Mike said, every hour if you want to.
Yeah.
But most people don't.
Yeah, right out of surgery, you're not going to do it.
No, not out of surgery.
If it's like a month out, people are more prone to do more.
Do you have another question, Danny?
Yes, this is from Lisa. I was curious. I wear an AFO braces on both legs, drop foot on one ankle, ankle separation, knee fusion on the other. I need something I can use and have no movement in my ankles. Any suggestions?
So Lisa has some ankle problems. One side used, one side she has a drop foot. You could easily do this with those problems.
So people don't know what AFO is. It's an ankle brace that keeps your ankle in a locked position, like neutral, like my foot is right now. So if I was on this, as long as you had enough hamstring strength and quad strength, you can keep it.
Well, I would also say, Mike, if you put up the stand, it'll work easier. If we're flat and you have an AFO or a fused ankle, you're going to look like Mike does right now.
So I'm going to go like this. You're probably going to put it out further away from you.
Right.
And then you're probably going to straighten what you can with your knee. What did she say she has wrong with her knee?
Drop foot and it needs a fusion.
No, one ankle is fused.
Oh, one ankle
needs a fusion.
Okay.
So you're not going to get any ankle strength or movement, but you're going to get strength in the knee and you can get movement of the hips.
If you take your AFO off and your foot still has the range of motion to go flat, I mean, you can kind of work on your ankle range of motion. Your fused one's not really going to move, but your other one.
Oh, good point. Yeah, you wouldn't have to wear the AFO with this device.
We're not sure how locked your ankle is, though. I mean,
AFO, by the way, is ankle foot orthosis. It's just a brace that helps hold the foot in place.
Yep.
So you don't trip over your feet.
Basically. Do you have any more questions, Danny?
No more questions? All right, we'll move on from the knee glide and Fit Glide to our next knee device.
Which is that?
You want to talk? Let's talk about the book real quick.
Sure. So this is a book by Robin
McKenzie, one of the probably the most famous physical therapists in the world. In our world, he really knows what he's talking about. He has unfortunately passed away several years back, but he's written several treat your own knee, treat your own back, treat your own shoulder books, and he also has courses for the professionals like physical therapists, doctors, chiropractors, and through that, which I have taken many of his courses, I apply a lot of the stuff that you might have seen on our channel, Bob and Brad, was from that Robin McKenzie. He is the guy. He's the guy I turn to for trying to determine what I do, if it's right or wrong. Really was a sharp guy. This book, and you'll see it on Amazon. You see the ratings on that, Mike?
It looks like it's 4.5 out of 5 out of 450 reviews.
Yeah, 450 reviews. But you look at his How to Treat Your Own Back book. These are really excellent books. They go through the whole. They take you from square one. They tell you what you should be doing, what you shouldn't be doing, and they talk about what exercises you should be doing.
This is more advanced.
Yeah, and the book is only like it's $12 to get.
It's $13 for paperback. I think you can get a digital version for like $10 maybe. It's only 80 pages, very easy to read, very informative, tells you different posture things, different exercises, what's causing your knee pain, how you can.
And it takes you through an whole exercise progression. I will tell you right now, if you thinking you're going to have surgery I would try this first. You might not need surgery after this because it's amazing
Yeah.
how many people I've just a lot of times will instruct people first, and then sometimes we still send the book along with them if they seem so inclined.
You even got some different ideas than what I would normally do, so it's kind of interesting.
Yeah, it's funny because I'll think I know the whole book, and then I'll look back and I go, oh, I forgot that he also suggested that. Every day his courses, which they are still having his courses, I think, in 36 countries around the world. So he's worldwide popular. You learn even more. You learn little tricks of the trade. So I just really, if you're looking for the most inexpensive treatment for your knee today, and if you're willing to read, take a little time to read, this is the book for you. It's really the number one book I would recommend for treating your own knee.
Yeah.
I've read a lot of them, and nobody's come close.
It's only
Sure.
87 pages with all the added on
Right.
stuff, so it's really not that bad.
Really was a man ahead of his time, and he was at it for 50 years, and his concept held up, and they're still holding up today.
So Robin McKenzie, Treat Your Own Knee book.
Robin McKenzie.
Only $13.
Very good.
All right, you
All right.
want to talk about the massagers
Sure.
next? All right. So we got 3 different massagers here. We can start with the C2.
Now, when you are treating your knee, what we always tell people, you want to look above and look below. We have 3 joints here: the hip joint, knee joint, ankle joint. The weakest link is always the knee joint, and we want to make sure we are taking care of the muscles that cross the knee joint. So one of them is the quadricep. It's not one of them; it's 4 of them.
There's 4 of them.
Yeah.
They're up here.
We're going to say these for simplicity. We got the hamstrings
They're in the back.
on the back. We got the calf muscles. We got some of the hip adductor muscles on the inside. And on the outside, we have the IT band. So someone had just asked us earlier about if this fit glide or knee glide would help with the
IT band.
IT
syndrome.
band syndrome. Not really, but this could definitely help with IT band syndrome. So we often will massage not only the IT band, which you can't really do anything to it.
Well, if you stand up, Bob's white pant stripe is like where your IT band would run.
There we go.
Not all the way down. It stops
No,
just
it
below
stops
the knee.
right below the knee.
But that's your IT band.
Yeah, and it starts by attaching to the tensor fasciae lata and the gluteus maximus
Gluteus medius.
and gluteus medius.
Yeah, it's all your side hip muscles there.
Yeah,
And it runs down to here.
yeah. So you definitely want to massage these muscles, even though you're having pain down here on the outside of the knee. That's for the IT band. That's what you want to do is massage. Also want to massage the band, and they say, a lot of therapists say, why do you want to massage the band? You can't do anything to the band. This thing's really tough. You could pull a car with it.
So it doesn't, you can kind of stretch it, but it doesn't really elongate. But
No, but what you can do, the band might be bound down to the other tissues. So you can actually loosen it up so that it moves correctly and doesn't put too much pressure right here. So again, if you have pain on the outside of the knee, it could be IT band. You definitely want to try to massage both the muscles on up here on the hip and the buttock, and also you want to massage the band itself.
Did you guys have an IT band video on your massage series?
I don't know.
I don't remember. You can look up the massage series at Bob and Brad program section. There might be one on IT band or hip pain. They kind of talk about which massager heads to use. I have the air-filled one right now. I actually have the C2 massage gun, Bob and Brad one. Bob has the Q2.
I'll stop it here so they can see the air-filled one. What he was talking about, by the way, if you go to bobandbrad.com, go to the program section, and we have a bunch of programs, free programs on treating certain problems like back pain. And we have one that's just completely on massage. And under that massage, I believe we did one on our IT band.
Yeah.
I'd be very surprised if we did. This is the air-filled, move it forward here. That's the air-filled head,
We're
air-filled head.
We're actually releasing a knee program right now on YouTube as well.
Right. It's not up completely.
It's not
but
finished yet. It's in the
Right.
works. But
what's nice about the air-filled one is you can massage almost anywhere with this because you can go over bone
right
and it won't hurt. Now again, the problem with this is it's not as intense. So you won't want to use it on the deep muscles if you really want to get in there. We never recommend massaging, well, one thing over the neck or head. And also, I don't like to massage over any arteries. So like your carotid arteries, I wouldn't massage over those. But all these massage guns and handheld massager, they're percussion, which means the head actually percusses back and forth like this, translates. It doesn't just vibrate. And that's such a difference. I used to know of some of the guns that used to just vibrate. And,
so it actually has amplitude, so meaning it can actually go 7 millimeters deep into your skin versus just vibrating. It pushes down in there.
Danny's got a question for us. We're taking questions on knee pain.
There's quite a few questions here. This is from Carol. What is better, land PT or pool PT for bone on bone in knee and hips?
Okay, Carol, you said with him? She is wondering what's better for your knees and hips. Knees and hips? Mm-hmm. Land PT versus water PT. Believe it or not, I saw some studies recently that showed that actually like walking was better than pool PT. That might be surprising to you because you're thinking you're taking some of the weight off there, but they also take into consideration the hassle of getting to a pool. So they look at everything like what does it cost to get to the pool, and whereas land is free, obviously. So using a cane for a while quite often can help calm things down for a while, and then you can go back to not using the cane again. So Danny still got another question?
This is from Yasir. It says, hello, I have a grade 2 medial meniscus tear and it's hurting me for 2.5 years. Do you have any suggestions what I should do to heal it?
So Munir, how do you pronounce the name?
Yasir.
Yasir.
He's wondering, he's got a grade 2 tear in his meniscus, and he's wondering what he can do to heal it. You probably can't heal it. I'm sorry to say that, but what you can do, if it's giving you pain, you can stop having it give you pain. A meniscus does not have good blood flow. It quite often doesn't heal. If it gets rolled up on itself and actually locks up, if your knee locks up at any one time, you might be a candidate for surgery. If it doesn't lock up, if it moves smoothly, the best thing to do is one thing that as I recommend is using a cane for a while to see if it calms down. His knees tend to flare up and they calm down. So try the cane for a while, and you can do strengthening as long as it doesn't irritate the meniscus or the cartilage.
I should say quick, with the massage guns and massagers, how they can help with knee pain is you typically work the muscles, like Bob said, around the knee joints. You typically don't go right on the knee joint.
Right.
So whether it's IT band, your quads are sore and tight, your hip flexor, your calf, your hamstrings. So you're going to massage around the knee, not directly on it. If you have like patella issues, which is how your kneecap attaches, you can use that slightly on there. You typically don't want to go forward on, you want to go at a side angle.
He's talking about the patella tendon has it attached to the bone. You don't go on the kneecap itself.
No, so my kneecap was here, and then below it is my patellar. Well, my kneecap's there, but my patellar tendon's here, so you can work there. So you don't typically go on the kneecap or the knee joint, but you work all the muscles around it.
Yeah, if I find a lot of people have tight quads, and if you can stretch those quads or mobilize those quads through the massage gun, it's funny how it puts less stress on the knee and less stress on the joint, less pain.
If you have tight hamstrings too, and you can't straighten your leg all the way like this, I mean, you can work on your hamstrings in this area too underneath. With the Q2 or the C2 or even the handheld massager. Handheld massager is not as strong, but it's a lot cheaper in price. It's like $40.
The Q2, did you have another question, Danny? Danny has another question. Hold on just a second.
It was a follow-up from Yasir. He's wondering, when it comes to massaging, does the gun work also with the foam rollers? Do they work for massaging needs?
Yes, foam rollers work really well too. I find I use both. I use foam rollers and the massage guns. Uh, Depending on what type of foam roller you have, I like to use the real knobby ones because I like aggressive.
I have a vibrating one. I like that one too, and it's got nodules. So
Sure.
there's lots of variations, firm or soft. Pick what you like.
These tend to be a little more specific, I'd say. You can hit the right area of the muscle that really is giving you trouble.
Yeah.
And
I mean, if you're just a meniscus injury and you can get on the floor easily, go for it. I mean, if you're, an elderly person who can't get on the floor, is going to want to use a massage gun versus a foam roller.
now these all come with 5 heads. Mike mentioned the air-filled. Here's the round head.
Yeah, they're the most soft, and you can use around your knees easier. Some of the other ones might be a bit too aggressive. If you hit your big quads, you can use maybe the pinpoint one.
Yeah, we got the bullet. It's the bullet, right?
Yes, we got the bullet head. We got the fork.
I like using the bullet because, again, I've been doing this for a while, so I really get aggressive with the massage gun. And the thing is about these heads, too, they interchange very simply. They have an interference fit. I learned it from Brad.
Yeah.
You just pull it out, you can slide another one in, and she's ready to go. You've got to hold the button for 3 seconds before it starts.
Yep, and there's 5 intensities, so pick what intensity you like. There's no right or wrong, and they both come with a carrying case as well, so you can bring it with you. Super portable, rechargeable, automatic 10-minute timer on both of them. It's just
it shuts off after 10 minutes.
Just so it doesn't overheat. You can start it up again if you want. It's probably not going to overheat, but these are like home use ones. They're not for like the
clinic.
Yeah, the clinic where you're constantly massaging all day. They might get burnt out after a bit.
So this is really interesting. This is the one I use at home. It's the Q2. It's very small, but it's very powerful, very shockingly powerful. My son, who's kind of a beefy guy now, he actually likes to use this one over the other one because he can get his hand on here and really get some good leverage on it.
Yeah, that's got a very different ergonomic grip compared to most massage guns. I mean, they make them all sorts of ways. It's like triangle ones and U-shaped ones, but that one's got a...
Yeah, you can keep it in your pocket. You can put it in your purse. You can put it in your bag. It's just very compact. I have been using this for, I don't know, what, 9 months now. And just, I don't have to charge it up very often. And it seems like it holds a charge for a long time. Really a solid device. I could see, what are the reviews on that? Is that the little one right there?
It's like almost 5 out of 5. I can't quite see 1,598.
Both 5 stars. I mean, I think if you look into it, it might be 4.8 or something like that.
They got a 1-year warranty on them too. Something malfunctions, it stops charging, different things like that. It comes with a charging cord. They both do. You plug it into a USB plug-in, so like your phone charger or your laptop. Does not come with the plug part, but it comes with the cord. So.
Right. Most of us have the plug, I guess.
Yeah, if you have a phone charger, you have the plug already. I'm actually holding now the Handheld Massager. This is a more inexpensive one. It's $40. It's Bob and Brad brand. Bob and Brad brand. That's a mouthful.
Yeah.
This weighs a little under 2 pounds. It has 5 heads, just like the other ones do. These ones you just thread on versus the friction fit. So you can just slide them on. You pick which ones you like. It comes with a stand. It does not have a carrying case like our other ones.
It's not as aggressive as these are.
Yeah.
This one's not as aggressive as...
My parents have one of these. My grandma has one of these. My parents are in their 60s. My grandma's in her almost 90s. My grandma likes this one. She's very content with this. It has a longer handle, so if you can't bend down as well either and you want to get your calf, you can just use the long handle to get down there.
Yeah, my mother-in-law, I got her one of these, and she uses it on their foot all the time. She has neuropathy, and she says it feels really good. I don't know if it helps, but it feels really good. And
I like this round head on my calf, actually. This is the only massager with this style head. You can use it on forearms or part of your leg.
it slides over close too easy.
Yep.
But yeah, that one's a lot more inexpensive. It's only $39. So it's really, I've given a lot of these away. I've given,
It's pretty powerful. I mean, you could sit like on my calf. It's pretty powerful.
yeah, I've given away probably 10 of those. I've given away at least 50 of these.
This has a 20-minute turn off feature. So after 20 minutes, it'll turn off. You can start it up again if you want. And yeah, it's rechargeable just like the other one. This one has modes.
Right.
So this one can be non-stop running, or it can be like an intermittent burst where the massage guns are always constantly running. Another question?
This is from Leah. What can I do for iliotibial band syndrome?
Oh, we talked about IT band syndrome just a little bit
So
ago.
Leah's asking a question about what about IT band syndrome. We just spent a whole discussion on that.
IT band runs from your outer hip down
If you
to
can see where my stripe is.
just past your knee.
Yeah.
The band gets tight on some people, it can cause knee pain.
Right, especially with repetitive activities like running or walking or biking. Very common to have pain on the outside of the knee. What we recommend is, one, you want to massage like the tensor fasciae lata, gluteus medius, gluteus maximus,
So
muscles right up around the hip that attach into the band.
up in this region.
Yep. But you also want to massage along the band. And many people say, why massage along the band? Because you can't alter the band. The band is really tough.
Yeah.
It's really made out of a tough fibrous material. Because the band itself could be adhesed down to the tissues below. And if the band is not moving like it should, it could give you pain along the outside of the knee. So I would go ahead and massage along the IT band. We've treated a lot of people with IT band syndrome. This is my first. I have people stretch it, and I have people massage it.
Yeah.
And the massage gun, by far, has worked the best because you find the tender spots. If you are massaging along the IT band or the muscle, and it doesn't hurt at all, it's not tender at all, that area is not requiring massage. The area that requires massage is usually tender.
Sometimes you want to put your muscle on a little slack too. Maybe not have it as tight. It might be easier to massage. Like if I was straight up on a stool, it might be a little more intense, or it's a little more slack. You can also use like foam rollers too if you have. They work well for IT band syndrome if you can get down to the floor and you're safe with that. But yeah, I actually have tight IT bands. My knee clicks on this side.
Well, good for you.
Mine doesn't hurt though. I'm pretty lucky, but yeah, mine click.
What's nice about the massage guns is that if you have a problem, you can use it for that, but you will come up with another problem as you get older that requires a massage gun. We always say, in regard to our channel, Bob and Brad, this is Bob and Mike, that someday you will come to us because you will have a problem. The body always breaks down eventually in some way, some form, some fashion. And so we show you how to treat it yourself. And the massage guns, I can tell you from, again, giving away at least 50 of these, that everybody who received them loves them. This is one of their favorite gifts. That's how I get friends. I give away massage guns.
He does give away a lot of massagers.
Yeah, I do. And people always come back to me and say, I love it, but I have to fight it away from a family member. We dropped off a bunch of these in our appreciation, and people were actually taking them home, and they couldn't use them because people were taking their turns at using them in their own house.
I mean, these are super versatile. You don't just have to use them for legs or knee pain. I mean, you can use them anywhere in your body. So they're very beneficial that way. Like a foam roller, you can roll a lot, but you're kind of limited on certain areas, where massage guns, like the ultimate.
It's right to the specific area.
Yeah.
I have a friend that uses it on tennis elbow, and he doesn't massage right on the elbow itself, but massages the muscles that lead up to the elbow. And he does this prior to golf. And last year he had to quit golf because it got so bad. Mm-hmm. This year he's been able to golf right through without a problem. So he does it before he golfs and after he golfs. I'm on a different topic now.
Another question. Yeah, you go off on tangents.
There's a question from Kim.
Hi, Kim.
Hi, Kim.
What kind of band or connection on the inner thigh would cause similar issues to the IT band? I have a floating I have floating hips, and the right knee has been a problem for over a year and seems to be caused by a pull from my inner thigh down to my kneecap. As I walk a mile or two, the right knee becomes harder to bend. I stretch a lot but can't figure this out.
Okay, so Kim is having some problem on her inner thigh. And now that could be a lot of things. I mean, you're going to want to get checked out. It can be actually from your hip. It can actually be hip arthritis that can send pain down to there. Another common cause is actually you have three muscles that come down the inside of the knee. And this is called the pes anserinus bursa. A bursa is a fluid-filled sac. It hurts right on the inside of the knee. And you want to stretch on the inside of the thigh. You know, one way you can just sit cross-legged like this and use your elbows to push them out and give it a long stretch. Massage gun works really well for this because you get right in and you can find, if you can find a tender spot, you go, oh my God, I didn't know that was there.
Depends on your flexibility too.
Right.
You can do a frog stretch, I guess, but that's more advanced. If it's hurting a lot, you probably don't want to do a frog stretch, but it's an option.
Sorry for black on black here as far as you can't see the massage gun. Sure.
There you go.
But you can actually, I'm actually a little bit surprised here how much pain I'm having on the inner thigh. I stretch this and I foam roll this. I don't massage my inner thigh. I've tried to pick the spots that are really bad, and on me, there's always one every day. So, another question, Danny?
There's a couple people asking for osteoarthritis in knees, can the massager help?
Okay, there's a couple people asking for osteoarthritis and knees, does the massager help?
So we kind of talked about it. You kind of want to massage the muscles around the knee joint itself to relax them. So quads, hamstrings, calf muscles. Typically, you're not going to do too much of the anterior tibia here,
right?
Because it's pretty bony there. Your tibia is there, but you can't really massage in the joint itself. If we want to talk about the Thermatex infrared heat, that might be good for your arthritis in your knee.
Let's grab that.
We do have that linked up, but yeah, you can't really massage away pain for arthritis. You might want to try doing what is here is a Thermatex far infrared heating pad. It would be an option to heat up your knee as well. Otherwise, the knee glide and the fit glide, like we talked about earlier in the video, you can rewind it. That would be good for arthritis.
Yeah, as we said, hit the muscles around the knee, including on the inner thigh and the outer IT band, everything across the knee. And I always find how amazing it is that people's knee pain will decrease once you have loosened the muscles up. The muscles aren't pulling as hard anymore. Mike is showing the Thermatex far infrared heat. It's they're not platinum model. Yeah, platinum model.
This is the platinum model, yes. There are different models. There are some specific for specific joints. I do not believe they have a knee joint.
Yeah, they do have a knee joint.
I know they have shoulder, elbow, a couple of other ones. They have specific knee joint if you want one. This one's nice because it's versatile and you can use it anywhere you want.
Right.
This one also, when you order them, comes with 2 straps. The specific joint ones will come with straps, but not the other ones. So if you want the straps to hold it on better, this is a much better option.
Yeah, I always recommend the platinum one because it is so versatile. Like you can use the knee one for the knee problem, but I can guarantee you, like sometime you're going to tweak your back, and
you should probably hold this. I'm wearing a dark shirt.
This is what I use this for all the time, especially in the winter. I leave it on in my chair. And that's the first thing I do when at night is when I watch TV is I just lay against this for hours.
Yeah.
I mean, if I watch TV.
Back, shoulder, neck, knees, ankles, foot, wrist, hand, and you can do this on anything. You just got to wrap it around it. It is a plug-in. It's not plug-in. Comes with a pretty long cord. You can leave it plugged in, and it's not gonna.
Yeah, it costs only pennies a day. People are going to ask, why spend this much? We'll take your question in just a minute, Danny. People are wondering, why spend this much on what could be considered a heating pad.
Mhm.
Because it's $219. They're really pricey.
Yeah, this is their top end model, meaning it's the largest one, and it comes with the strap, so it's a little more pricey.
So regular heat only penetrates like a millimeter, only skin deep.
Yeah.
This actually goes 2.36 inches. So imagine how much more it goes into the joint.
It penetrates. A lot
Yeah,
deeper.
it actually, if you go around your knee joint, it actually penetrates all the way through the knee joint. If you do it in your back, it gets into the joints of the back, into the muscles of the back.
Mhm.
It's really a different feel. It's not intense. A lot of people think it's only one intensity, in fact.
Yeah, you don't adjust it. It has one button. You just turn it on and off and plug it in. It's between 108 and 116 degrees Fahrenheit is the heat it goes to, but it's not intense heat. It's not like a moist hot pack that can get really hot or anything. You don't really have to worry about for anything with these. It's a weird.
I wouldn't fall asleep with it.
It's a deep heat. It's different. Yeah. It's different to explain because when you don't feel like hot, but it feels like the muscles are warmed up.
Right.
And it's only 2 pounds, super lightweight.
Yeah, I really like it for back pain. If I want to be honest.
Yeah.
Because you can actually put it in your chair. You can have it in your office and leave it on there.
Yeah, if I were just to use it for knee pain, I just wrap it around depending upon which part of my knee, whether it's the top or the back. Strap it up. Just strap them on there, leave your legs straight, and heat it up.
My mom had fallen and she had hurt her ribs, and I got her one of these for that because I knew that it would penetrate deep into the muscles and the joints and get to the ribs, the rib joint that was kind of hurt. So, Danny, what's the question? Yeah.
There was a couple more for the, one for the massager.
Sure.
Where do you use the massager for plantar fasciitis?
So the question is, where to use the massager for plantar fasciitis? So very simple. You're actually going to hit the bottom of the foot, and while you're doing it, by the way, what I recommend is, and again, I apologize, I'm going to actually take my sock off here. I know we're going from knees to plantar fasciitis here, but somebody had a question, and I want to be helpful. So you're going to actually start the massager, and you're going to work the bottom here. A lot of times the pain in plantar fasciitis is right here, right by the heel. That might be too tender to start off with. You actually massage around it to start. And what I like to do, Mike, is actually move the foot while I'm doing it. You get different spots.
Yeah, this is handy for that. I happen to have one of their foot massagers because I work for them.
Yeah.
So I just use that. I prefer that, but the massage guns work just as good. I mean, you don't have to buy all of them, but the foot massagers are pretty handy, the Bob Brad ones as well.
Really important also with plantar fasciitis that you do massage the calf too and stretch the calf. Because the tighter the calf is, the more stress it'll put on your plantar fascia. So you want to make sure you catch both.
Yeah. Are there any other questions about massage guns or Thermatex infrared heat?
Again, I don't know if I would get a Thermatex just for your knee pain. I really don't.
If you have chronic pain,
fibromyalgia,
or throughout your body, you got pain like low back pain, knee pain, shoulder pain, whatever, it'd be worth it. If you're just like recouping
I wouldn't get it just for knee pain. I got one for my aunt who has fibromyalgia, and she could use it all over her body and at different times and depending on what's sore, and the deep penetrating heat really makes a difference. I know the company Thermatex, I've talked to a couple of the representatives there, and they have one sit in a chair that they've had on for 18 years. They just left it on for 18 years, and people come in to their office and they just into their waiting room, and they actually can sit on it and feel what the Thermatex feels like. But you can keep this on for a couple hours, and it really does wonders on back pain.
Yeah.
In that instance.
They're a Canadian company too. Fun fact for you.
They're Canadians.
Made in Canada.
All right, Mike. What other products?
We got 2 more products to talk about. One's more for stretching your knees out. This is the Stretch Strap by Bob and Brad. Has 12 rings in it. You want to hold that?
Sure.
I can't remember what the price is on this. It's not too
now
much.
Think about it's really quite reasonable. Brad and I will
$18.
$18. Brad and I were really particular in this band on how it was going to look, how it was going to feel, how it was shaped. This one, it actually has kind of loops that make it really easy to put your hands in there or your feet in there. The loops are really quite large. It's also very slippery, so that when you are stretching something, you can slide along your clothes. It's also quite long, and it's also quite strong. So the thing about a stretch out strap, you can actually, Mike's going to get on the floor this time.
You can stretch out.
Yeah, the hamstring is a good one to do with this.
Hamstring if you want. So you can hook your wrists in here. For grip.
If you have arthritic hands or wrists, you can actually
work on stretching your hamstring this way. That other camera view is probably looking right down my shorts. I'll go this way.
Again, when you're having knee problems, you want to stretch the muscles above and below the knee.
So this would be stretching my
hamstring, which is above the knee. You also stretch the calf a bit.
Yep, if I bring my toes
towards me. Toes towards you. You can also sit up and do the calf like this.
You can also do it like this. If you want to try and stretch up into hip flexion, so this would be more your buttock.
Right.
You can actually, or if you don't want to work on your knee bending and you can't reach, you can use this to help with that as well. If you're trying to increase your knee range of motion after a surgery or something. If you want to stretch it, you just go like this.
You can actually use it with the foot glide or the knee glide.
Yeah, you can put the knee glide down there because right now I got some friction for my shoe, but then it would really glide.
What I'd like to show you, Mike, if you'd show them how do you do a quadricep stretch with these, because I think the quadriceps are tight on a lot of people.
Laying down?
Well, you can do it on your side.
Yeah, I was gonna say.
Yep. So here's one way. You can do it on your side, and
so
he's going to show how you bend it that way. Because some people, if you have pretty good balance, you can actually do this standing, but that's probably the best way to do it. You can also lie on your stomach and do it that way. This is one. And again, this is where the long strap comes in handy. You can actually bring it up over your shoulder, and you can go up like that. There you go. Great way to stretch that quadricep, which is really difficult to do, and highly recommended. I just saw two friends. Both were having knee problems, and with both of them, I recommended stretching their quadriceps. They had really tight quadriceps, and if that quad is tight, it's going to send tightness across the knee. And there's going to be more pressure on the knee. So
you don't have to use both sides either. You can just use one.
Look at Mike. He does have the balance to do it. Difficult stretch to do. This would be a younger person. So if you are like going to a race, a running race, 5K, you can bring one of these along. You don't have to worry about getting down in the grass. You can find a place to sit down. You can do some stretches that way.
Yeah, or after you work out and you want to stretch.
Yeah.
It's handy to have.
This thing too, Mike, you want to mention this, right?
Yeah, we got one more product to mention, and we'll take any last questions about knee problems or any of the products. So this is a elevating leg rest pillow.
This just puts the knees in a nice position. If you are a person that likes to sleep on their back, this works really well for that. If you have trouble with edema or swelling in the leg, is a great thing for that. And it actually works out well for most types of back pain too.
So all you do is put the wedge part towards your buttock and then put it where it's comfortable, and it's going to elevate your legs above your heart. In the easy way, if you need more pillows, you can add more pillows. If like you had a knee surgery or something. But this is just a nice option there.
Yeah,
There's tons of brands. We have some link below. They're literally all pretty much the same thing. They're like a memory foam. They have a removable, washable cover. They're all around the same price range, so we're not going to say one's better than the other, but they all work well.
So again, why does it feel good on the knees? If you tend to, again, sleep on your back, your knee is going to be straight all night long, and knee joints don't like to be at end range. They like to be bent just slightly, what we call loose packed position, and that leaves more room in the joint for the fluid and the blood and everything to circulate.
Yeah, and it can be used for any leg surgery. It doesn't have to be knees. Didn't your wife have, what did she have?
She had some
Varicose
pain.
veins?
Oh, varicose veins, yeah.
She had varicose veins. My girlfriend had patella surgery years ago, and I stole this from work for her for a few months. And yeah, no, they work great for that. So.
Yeah, again, if you lay on your side, if you lie on your side, you have to take it out of place.
This isn't.
I know Brad uses it for his back. He loves this for his back, and he puts an ice pack in his back, and he'll fall asleep with this on, with this in place. But then after he wakes up in a couple hours, he just kicks it out of the way, and he goes back to sleep or sleeps on his side. So
yeah, so if you have chronic back pain or some edema or long-term leg issues or surgeries coming up, this is a pretty handy little tool to have. So,
all right, Mike, we went through all the products. Do you want to? We got a question yet?
Yep, we got a few questions. Some are
Any questions yet?
answer the last questions here.
They're wondering, how long can you keep the heating pad on your knee or back?
All right, the heating pad, I know Mike says it has very little chance of burning you, but it could. So on your knee, I would maybe keep it on for a half hour. It takes a while for this to get up to the right temperature. It takes like 5-10 minutes.
Yeah.
So you might be wait for it to hit the top temperature, and then you can go another 20-30 minutes on your knee. On your back, I leave it on for hours. I mean, it just...
Yeah, it depends on how much pain you're having.
Right.
When you heat it up, the heat increases the blood flow to the area. So it's good to take a break from it for a bit, so then the blood flow go away. And then when you heat it up again, it'll come back. Your blood flow carries all your nutrients and helps with repair of any damaged areas or cells or things. So.
Yeah, they recommend actually twice a day for back pain, 45 minutes. And that seems like a lot, except that you can do it at work if you sit, or you can do it at home if you watch TV. So it's really not that onerous or difficult to do.
You just have to be by
Yeah, the other thing, you can actually stand and have it in place.
I'd have to strap it on the Velcro here, but you can strap it on.
Right.
If you want different areas. No stain.
And then, like, if you have to go to the bathroom, you just unplug it.
This is the Platinum model. You have to read the other ones. They don't all come with straps, just to FYI.
Right.
But yeah, you have to have it plugged in. But then I guess you don't have to remember to recharge it.
That's right.
All right, any other questions? Danny's got one.
There's a couple just general questions. Are there any opinions on cortisone shots for hip and knee arthritis, or what about knee gel injections? Are they safe and do they work?
Knee gel injections? I'm not familiar with what gel they're talking about, but they're wondering whether or not cortisone injections are good for knee pain or hip pain. I've seen the studies on this. There's been a couple of groups of physicians that have put out recommendations of whether or not cortisone shots are good for knees and hips. And in both cases, they say yes, it's worthwhile trying. I think you can get 3 a year, I believe.
It depends.
Yeah, it depends
on the type of shot it is.
Yeah, so
it's a rooster comb or a different one.
Yeah, rooster comb, no. They say no to the rooster comb, but the cortisone, yes. Definitely worth a try. I've seen it go both ways in patients. I've seen it help immediately and continue to help, and I've seen some people that say it helped a couple of days and no longer helped again. So it seems to be specific to the person.
Yeah, I've seen the most success with cortisone shots if they have an acute injury and it's limiting them for the time being, but it's getting better. So the shot will minimize the pain for a while. Typically, chronic pain issues, it'll help for a bit, but the pain comes back. So
eventually.
Yeah.
So another question.
This is from Austin. Can a tight piriformis on the left side affect the right knee pain on the outside?
So can a tight piriformis, which is a little muscle in the buttock on the left side, affect pain in the knee on the right side? The thing about it is when you have pain anywhere, it's going to throw you off. And
yeah, it could throw off your pelvis, I guess, if you're sitting weird.
Well, you might walk weird, and if you walk weird, that can throw off your knee. I mean, I would say this: it's probably not causing you knee pain, but if you're having knee pain, it might be making it worse. So I would treat the piriformis. The number one treatment we do for piriformis is we massage the muscle. We stretch it too, but we take the massage guns. In fact, this is the one I recommended for my sister because she could get right into the area really quick, really easy because it's handheld massager. She did this and it took away her Piriformis Syndrome along with stretching.
I've done this one where you just kind of do the figure 4 slash.
Sure.
So you can really kind of get in there.
So Mike's in a figure 4.
So I'm in a figure 4 angle and I'm stretching the area. And sometimes I'll just move around my knee back and forth because then you kind of find the hot spot. Because sometimes I can't notice it, mine doesn't, but sometimes if I move around, I can find a different area.
Yeah, what they now are calling Piriformis Syndrome, they call it deep gluteal syndrome because it's often quite a few muscles. They think it's the gemelli and obturator. Don't make me name all the ones I don't remember.
I don't remember the other ones either.
So, Mike, do you want to flip that up? Thank you.
Any more questions, Danny?
Yes,
More questions.
More
All right.
questions.
Crooked on there.
Let's see. Marie would love to know, for the massager, where would be a good spot to use it for arthritis on the lower back?
Okay, Marie wants to know for the massager where to use it on your lower back. Now, one, you'll hit the muscles on the lower back, Mike, if you mind turning around. So you don't go along the spine itself, but you hit what we call the paraspinals, muscles on each side. Now, this is one where you might need a partner. I mean, the handheld does work.
Handheld reaches, but the guns won't work as well.
Yeah, and the guns, you could have someone really get in there when you're lying down too, like you'd be lying on your stomach and really hit under there. You can actually also, believe it or not, you can massage your buttock because that attaches into a fascia that attaches to your back, and also your latissimus dorsi, that's a muscle right here. You can see the lats on Mike. These muscles, again, if tight, will pull into the back too. So you can hit all the muscles that go attach into that fascia, and it can take some stress all the back. But I would start by hitting it right on the back, off the spine, but on the sides of it. All right, Danny, just a couple more questions.
One of the follow-ups about the gel questions. You Flexa gel injections. It puts the lubricant back in your knees. That's what they're wondering about.
I'm sorry. The question, the follow-up question that she's talking about gel whether or not we recommend it is you Flexa gel, and what do you need for lubrications? I'm not familiar with it. There's a lot of different procedures out there right now, and some of them they seem promising at first, and then they have to do studies. They're more questionable. So.
Now,
I haven't heard of anything that really stands out, except the cortisone seems to be the best thing right now if you're going to inject something in your knee.
yeah, and I've only heard of that in stem cell, but that's a completely different animal.
Right.
They're asking about stem cells.
Stem cell, yeah.
I don't think that's paid by your insurance, but if you want to go about that, I guess do your research on it.
Yeah.
We're not experts on that.
Yeah, you can go to pubmed.com. It's the site.
.com or .gov?
.gov. You're right.
PubMed.gov.
And
Search up whatever shots you're talking about and see what the studies say on them.
Yeah, you can at least get the summary of the study.
Yeah, they give you the abstract.
You can usually understand them. So.
Another question?
There's two. One's from Kathy. Is it common to get tight/shortened hip flexors due to guarding the leg that has knee pain?
Kathy's wondering if it's common to get tight hip flexors when guarding the leg that has knee pain. It's common to get tight hip flexors no matter what you do, because hip flexors tend to get tight when you sit a lot. So, and most of us sit a lot or sit too much. So your hip flexors are probably tight. And
yeah, that could pull on your knee more in a different way, or make you walk differently. So it can affect your knee. Anything from your hips to your ankles can affect your knees.
Again, we call it the weakest link. There's 3 joints here, and of the 3, this is the weakest link, the one that takes the stress when you do weird things that the other do.
Yeah, I mean, your knee joint really only bends and flexes and extends. It doesn't really have, it has a lateral
rotation,
but not a whole lot compared to like your hip.
Yeah.
Your hip has a ball and socket joint. It can do a lot more.
The last question is Christine. She's asking, can I have a knee massage now after I've had knee surgery from a torn meniscus? They're having a weekly physio.
So Christine is wondering if she had knee surgery for a torn meniscus, and she's wondering if she could do a massage. Absolutely yes. Again, based upon what we said before, you don't massage on the joint. You massage the muscles that go across the joint. So the quadricep, hamstring, maybe the muscles on the inside of the thigh, maybe the IT band, or even the calf muscle goes up across the knee. So if you massage those, it's just going to put less stress on the knee, and generally it's going to help. Now, is it the number one thing I would do for that? Probably not. I would probably get the strength back and make sure you're not putting too much weight on it. But it's something I would add to my toolbox. And again, I have no qualms about recommending a massage gun, because if it doesn't help you with your knee, you'll use it someday somewhere else. I mean, these are always coming in handy.
Yeah, they're super handy. The Thermatex is, it's more pricey and not as handy. If you have chronic pain, that's good. The leg wedge, obviously, is just for leg stuff. Massagers can be used anywhere.
Yeah, I have no qualms at all
about
recommending
strap
massage guns.
It's cheap. You can use it any stretch you want.
Yeah.
So.
Yep, arms and legs and all that. I think we're at a cutoff, Mike. Now we're
71 minutes, pretty long stream. We'll be back probably next Monday.
Are we back this week? No, next Monday.
We'll be back next week.
Next Monday, stream. We'll talk about, I don't know, maybe the shoulder. Did you shoulder?
We did shoulder already.
How about back maybe next time?
Back or hip, something like that.
Yeah.
McKenzie book, $12. Treat your own knee.
Be excited about it.
Treat your own knee.
Yeah.
Very easy to read. Good book. I guess I would start there if you are having knee problems. All right.
Thanks for watching, everybody.
Thanks.
Really appreciate it.